I'm pleased to welcome you to the 11th session of GCHA's pilot course on global engagement on climate and health. There is Spanish interpretation available. You can enable it by the interpretation button. And it is right next to the apps button right now in the new Zoom interface. Bienvenidos a todas y todos. Tenemos interpretación simultánea. You can activate it. Pueden activarlo con el botón de interpretación. Muchas gracias. To kick us off, I will give the floor to GCHA's policy lead, Jessica Bigley. Everyone on the call knows her, but she's also the main brain behind GCHA's work on NDCs. So it's a pleasure to introduce Jess and to start the presentation.
That's so kind. Thank you, Melina, and really lovely to see everyone here today. So I'll start with a little bit of background on NDCs. So they are national commitments to deliver the Paris Agreement. Every NDC has to include mitigation, so an emissions reduction target, but governments can choose themselves whether or not they include adaptation in their NDC. And the Paris Agreement says that governments can submit their adaptation information through NDCs or through dedicated adaptation plans or national communications or adaptation communications, multiple different channels for submitting adaptation information. But the emphasis is that it needs to be submitted, of course. For NDCs that were developed up to the middle of 2023, the UNFCCC produces an annual synthesis report. And what we understand from that 2023 synthesis report is that if NDCs as of 2023 were all implemented based on unconditional actions, that actions that governments already have funding and technological capacity to implement, then emissions would be reduced 2% by 2030 compared to 2019 levels. That would increase to 8.2% if conditional actions in NDCs were also implemented. So depending on finance and technical capacity and other forms of international cooperation. At the moment, given those NDCs from the middle of 2023, we are looking at peak temperatures somewhere between 2.1 and 2.8 degrees Celsius by the end of the century, which would be catastrophic for human health, especially once we move towards the upper end of that range. And what we need to be at by 2030 is 43% reduction. So not 2%, not 8.2%, but 43%. NDCs are due to be updated by February 2025. So we're really hoping to see increased ambition on those emissions reductions to get us closer to what we need to be aligned with Paris. We know that Brazil, the UAE, Azerbaijan, the UK, and the US are likely to submit in advance of that deadline. In practice, a lot of parties do submit after the deadline that's imposed for NDCs every 5 years. And it's important to say that although we need people to move early on NDCs to understand where we stand, the fact that a country is submitting early is not a guarantee of the mitigation target being an ambitious one. I'll move now to the next slide. So just to talk through health entry points. In NDCs, we see NDCs that talk about the health impacts of climate change, whether in terms of naming specific health impacts or the number of lives that were lost or the people that were displaced during extreme weather events. There's often actions on adaptation in the health sector and additionally on mitigation in the health sector too in many countries. We also see NDCs that talk about the health co-benefits of climate action across other health determining sectors. So recognizing the clean air opportunities of mitigation in the energy sector, the ways to ensure nutrition security through adaptation in the agriculture sector, the importance of preventing waterborne disease through resilient water and sanitation sectors, opportunities to promote physical activity through mitigation in the transport sector. And another entry point is around which gases are monitored, knowing that many air pollutants are both greenhouse gases and immensely harmful for human health, especially short-lived climate pollutants. So lots of opportunity there. Milena, shall I pause at this point and we can pass to Sandra and come back to me later?
Sure. Well, it's a pleasure then to introduce our next speaker, who is connecting from Chile. And this is Dr. Sandra Cortez. She is a veterinarian, master in biological sciences with a mention in environmental sciences, PhD in public health. She's a researcher in health and environmental epidemiology issues in Chile. She has published some pivotal research to visibilize the harms of fossil fuels on health of the communities. And since August this year, Sandra has been the president of the Scientific Committee on Climate Change of Chile. Congratulations on that, Sandra. We're looking forward to hearing from you about the objectives of the committee and how it is planning to engage with the NDC of Chile, and especially on health. The floor is yours.
Thank you so much, Milena, and thank you for this invitation. Sorry, but my mother language is Spanish, so I prefer to speak in Spanish. Please, Milena, ¿puedes confirmarme que se ve bien mi pantalla? You could see if my screen is good. Okay, thank you. Muchas gracias a la Alianza de Clima y Salud por esta presentación y esta oportunidad de mostrar nuestro trabajo como Comité Científico de Cambio Climático. Quisiera comentarles que esta es una iniciativa que por primera vez en Chile fue liderada por el Ministerio de Ciencias, que durante el año 2000, a fines del 2023 y principios del 2024, hizo un llamado abierto para los distintos investigadores del país para conformar este Comité Científico Asesor de Cambio Climático. Tenemos el privilegio de ser el segundo comité científico porque hubo una experiencia que emergió durante la pasada COP25. Si ustedes recuerdan, esta se iba a realizar en Chile y a consecuencia de la revuelta social que hubo en mi país, no se pudo realizar y se trasladó a Madrid. En aquella ocasión se convocó a un grupo de investigadores para poner en relieve, ¿cierto?, la evidencia científica sobre el clima, y se formó entonces el primer comité científico que luego fue, digamos, formalizado con un decreto hasta el año 2022. En esta ocasión, en este comité que me toca liderar, nuestra tarea es principalmente asesorar al Ministerio de Medio Ambiente respecto a los aspectos científicos que se requieren para la elaboración, diseño e implementación de todos los instrumentos de gestión de cambio climático para Chile. Y para ello se dispone de una ley marco de cambio climático que es la que nos mandata para poder entonces considerar todos los aspectos críticos de cambio climático en Chile respecto a matrices tan importantes como agua o biodiversidad, ciudades, energía, criosfera, Antártida y océano. Y por lo tanto, desde el Ministerio de Ciencia se genera esta iniciativa, ¿cierto?, que es el Comité Científico de Cambio Climático, como un apoyo principalmente para asegurar que la ciencia esté en la toma de decisiones, pero también haciéndose eco de la política de ciencias en Chile, que tiene otros criterios de interés, como es los principios, no solo principios científicos, sino que también aspectos territoriales, de equidad de género, que se articulan en todos los instrumentos de gestión nacional respecto a cambio climático. Eso para nosotros es una cuestión muy innovadora, porque además nos pone como en un puesto, digamos, a nivel latinoamericano, como otros países como Costa Rica o México, en donde hay una instancia específica para asegurar los criterios científicos en la toma de decisiones para cambio climático. Y eso, como les decía, está amparado en la Ley Marco de Cambio Climático, que es una ley del año 2022, que tiene además un reglamento de funcionamiento, que es el decreto 15 del año 2023, en donde se define nuestro funcionamiento y de nuestras funciones y nuestras responsabilidades como comité científico. Quiero destacar como tareas importantes que nos toca en el comité es analizar la evidencia científica que hay para todos los instrumentos que nos competen a nivel país, especialmente la política nacional de largo plazo para cambio climático. Tenemos que proveer también de informes técnicos o informes basados en evidencia para todas las políticas que se puedan hacer a nivel nacional y que puedan traspasarse también a nivel regional y a nivel local. Tenemos que colaborar en la elaboración de una estrategia de desarrollo y transferencia para generar lineamientos científicos respecto a la evidencia que se genere en clima. Eso es bien interesante para nosotros porque nos permite de alguna manera ir direccionando a través de lineamientos para que el Ministerio de Ciencia investigue en todos los ámbitos que se consideren prioritarios o urgentes para Chile. También tenemos una opinión respecto a la elaboración en el fortalecimiento de capacidades. Esto se refiere especialmente a las capacidades de los equipos técnicos que están en los distintos órganos del Estado para, digamos, ir formando personas en este tema. Y además nos piden opinión respecto a la evaluación de las tendencias globales de investigación, respecto a los mejores insumos que puedan haber para la toma de decisiones en cambio climático. Podemos proponer estudios, tenemos que responder ante consultas específicas que nos haga el Ministerio de Medio Ambiente. Y eso en realidad es muy motivante para uno que viene desde el mundo científico. Sin embargo, es bastante trabajo. Tenemos reuniones, al menos tenemos que tener una reunión mensual. Nosotros hemos definido que vamos a trabajar, que nos reunimos cada 15 días. Contamos con un apoyo técnico desde el Ministerio de Ciencia en una secretaría que en la práctica son dos personas, un secretario y un apoyo de un periodista. Trabajamos ad honorem, por lo tanto nuestras universidades entregan parte de nuestro tiempo para esta tarea de alcance nacional y no tenemos una voz vinculante, somos un órgano asesor. Esto es lo que está establecido en la ley, ¿no? Bueno, esto es una foto de cuando asumimos. Aquí está nuestra ministra de Medio Ambiente, que fue parte importante en el primer comité científico, y la ministra de Ciencias. Tenemos investigadores, somos un grupo de investigadores de las principales universidades de Chile, algunas universidades regionales, estamos bien surtidos en temas. Y para nosotros es muy importante estar en este grupo porque también tenemos de alguna manera una responsabilidad social a partir de los compromisos de nuestras universidades. En términos generales, tenemos que proveer documentación, proponer diagnósticos, y esta es como una parte importante en nuestro quehacer, que es lo que hemos hecho desde que asumimos que esto fue a partir de agosto del año en curso, es que durante los procesos de participación ciudadana nos tenemos que pronunciar respecto a los aspectos científicos de los instrumentos que se están evaluando mediante la participación ciudadana para la política de cambio climático. Y eso quiere decir que durante estos primeros meses que hemos estado ya trabajando, hemos principalmente revisado los planes sectoriales de adaptación y de mitigación de los distintos órganos del Estado que estaban en proceso de participación ciudadana, y nos toca, por supuesto, participar en la contribución nacional determinada y en la estrategia climática de largo plazo. Para poder organizarnos, lo primero que hemos hecho fue definir estos lineamientos operativos para el comité asesor, de tal manera de poder poner un mínimo de trabajo que pueda ser acorde con todas nuestras otras obligaciones como académicos e investigadores. Respecto a la NDC, y con esto quiero terminar, nosotros somos asesores para el Ministerio de Medio Ambiente. Los estamos acompañando en su plan de trabajo. Por lo tanto, nos sumamos a todas las colaboraciones internacionales que el Ministerio de Medio Ambiente ha hecho respecto a la NDC, Y esto para nosotros parece ser que es bien importante, no solo para poder conocer las experiencias de otros comités científicos como ocurre con los otros comités científicos que hay en Latinoamérica o en otros lugares del mundo, sino que también de alguna manera eh, podemos beneficiarnos y nos pueden ayudar para que nosotros podamos asistir a las reuniones internacionales. Como no somos funcionarios públicos, no tenemos financiamiento, trabajamos ad honorem, no tenemos ninguna posibilidad de participar de las reuniones internacionales si no es a través de la colaboración. Y eso creo que es súper importante que se sepa porque si no, no podemos ir a ninguna de las actividades en donde quisiéramos estar. De igual manera, a través de nuestro comité estamos haciendo un trabajo de vincularnos a redes nacionales que estén trabajando en las diversas áreas que nos interesa de cambio climático y en lo particular, y por eso es tan importante esta reunión, para nosotros es muy importante la alianza la colaboración que tenemos con la Alianza de Clima y Salud y de la red que está funcionando en Clima y Salud en Latinoamérica porque esto nos permite fortalecer también la vinculación que hay con otras entidades no gubernamentales a nivel nacional. Tenemos aliados importantes como ONGs, Chile Sustentable, el Colegio Médico, la Sociedad Chilena de Pediatría, otras sociedades científicas que no solo para que conozcan nuestro trabajo a nivel nacional, sino que sepan también que el comité científico es una puerta para poder articular apropiadamente el trabajo en clima y especialmente en lo que a mí me interesa como investigadora en clima y salud. Por esta razón, estamos también comenzando a convocar grupos de trabajo específicos y el primero que hemos definido es justamente el trabajo específico en clima y salud, dada la urgencia que tenemos climática y las conocidas implicancias en salud poblacional. Y por supuesto, somos articuladores también para difundir la política nacional en cambio climático con otras entidades que estén vinculadas a órganos del Estado o representaciones ciudadanas. Para ello, hemos abierto este correo que está disponible para que nos puedan invitar, para que nos puedan consultar, para que nos puedan hacer requerimientos específicos, no solo a nivel nacional, sino que también a nivel internacional. Y creo que eso es lo que me interesa mucho poder compartirles. Muchas gracias a todos y a todas.
Thank you so much, Sandra. It's very interesting to learn about all of the different activities that can be done by the committee and also the opportunities to engage and contribute somehow to this work. So thanks very much for joining us today, for telling us about it, and we wish every success to the work of this committee, and we are sure that with your presence, health will receive the prominent attention that it needs.
Thank you so much.
And with that, we can first, I'd like to ask, is there any immediate question for Sandra? Because she needs to leave at the 30 minutes. So maybe if anyone could and has a question, can speak up. Kurt, please.
Hello, everyone. Thank you, Sandra, for.
I have trouble hearing Kurt. Is that true for everyone?
I did not get anywhere my mobile. I think my internet is very bad. Let me reconnect.
Now we can hear you. You can go ahead.
Okay.
Yeah.
So perhaps. Okay. NDC 3.0 partnership. I spoke with them at the SB60 meeting, and they said there is also quite a bit on health with regards to mitigation, adaptation, and also resilience, but it's all over in their kind of a support kind of tool. And admittedly, I didn't have a chance to look so far. So NDC 3.0 partnership, is it useful for health and climate change?
I can answer a little bit on that, unless Sandra wants to come in first. So, yeah.
I'm sorry, I can't hear very well. I don't understand.
You might be on mute, Sandra.
Just go ahead first, and I will translate to Sandra on message.
Okay. I was going to mention that the NDC partnership hasn't had a focus historically within the NDC partnership secretariat on health. They are much more interested in responding to health requests this year. The way the NDC partnership works is they take requests from countries and try to make the links with technical partners that would be able to help respond to those requests of how health can be integrated into NDCs. I think UNDP is a very active player within the NDC partnership, and they have a new person on their health team that I think will be really valuable for supporting the NDC partnership work. UNDP also does their own work on health in NDCs, and WHO is also a supporting agency for the NDC partnership. So I think we haven't seen a lot historically on health from expertise within the NDC partnership, but I think that is gradually going to shift, and they are working more and more closely with health partners.
Yeah, thank you, Jess. Obviously, for us, considering the importance that have health, it's very useful to receive help from some collaborators, and obviously the best way for us is start with the probably we have to organize an meeting with people working on health, and obviously we consider the apports or the help from the Global and Health Alliance, because we need to improve our diagnostics. We need to explore different risks that we need to measure in the country, and obviously the collaborators as GCHA are very useful for us, and we are open to organize some task force, including your efforts.
Thanks so much, Sandra. We are honored to be able to contribute.
Thank you so much.
And if there are no further questions, we can continue with Jess's presentation.
I actually have a question for Sandra, if she has time. I would be really interested to know about the government's motivation for having this advice on how to embed health more deeply in the NDC. I wondered if they had shared some of their thinking with you on why they are motivated to do that.
I'm sorry, I can't hear very well. Oh, okay, yeah. Yes, obviously, you know, we have a very different countries in the same country, and in fact, it's not easy to include all the issues related. But obviously, this government has made a lot of efforts to improve the action climate, and obviously, health is included in different levels. In this moment, for example, in several counties along the country, the people are working including health issues. And in fact, I received some invitations from specifically hospitals and other health authorities, local or regional. But in general, the motivation is tight, but we have to face the problems related to funding. and we are working on that, but depends. In fact, we have some limitations, but obviously we start improving our work, put the focus on health. It's very important, and the interest in the rest of the committee. We have people working on biodiversity or oceans, but all the committee agree that the health consequence related to climate are important. Put a focus in this moment because we are facing other
Yes.
problems, for example, the wildfires or some issues related to water scarcity are common for the people. They and the rest of the research and obviously understand the consequence on health. And so we need to put attention in all the issues, but in this moment, health it's important, and for the authorities are motivation also.
Thank you so much, Sandra. There is another question from Cecilia Alonio. Cecilia, you can unmute yourself.
Oh, yes. Thank you so much. My name is Cecilia Lonyo. I'm from Uganda. And you will be happy to know that Uganda has its health and climate adaptation plan. It's just waiting to incorporate it into the National Adaptation Plan. I missed Sandra's conversation on the NDC 3, but I guess I just have one small tiny question. I just want to know if there are any mechanisms in place to ensure coordination and implementation of health-focused climate actions across governments, across stakeholders. Maybe she mentioned this in her presentation. Just a brief of that, I would appreciate. Thank you very much. Otherwise, yes. Thank you.
Thank you, Cecilia. Yes, we have a very good instrument that is the law on climate change. And in the law is a very complex instrument that put several obligations to the rest of the institutions, governmental institutions, and open the door to a citizen organization on NGOs. And in that case, in the law, we have, for example, other committees that support to the different governmental agency. For example, we have technical teams, interministerial, focus on climate change. We have another council about the sustainability and climate change that put on the table different organizations, NGOs and others represents from the enterprise, for example, and that are for a national level, but we have the same figures at the regional levels. And so it's very useful because in the different regions, we have also other assessors council that are focused on climate. And in another way for improving the citizen participation, we have MESA, a kind of team focused on gender and climate and on other policies. And so we have a very good network considering the different levels, local level, regional level, national level, but we need to discuss for improving that network with more funding, with more specific tasks, but we start and our work as scientific committee is try to develop a public conversation to improve the national policies and the regional policies, and try to put some efforts also at local level. It's an interesting model. I think we could learn a lot about other experience, and we are happy because we have a framework for improving our work.
Thanks so much, Sandra. I know that you have to leave, but thanks so much for your time, and
Okay.
all the success to the committee.
Thank you so much. Bye.
Bye-bye. Then shall we continue with the presentation? And there will be another opportunity for inputs from the audience.
So we've heard from Sandra about some of her efforts to strengthen the integration of health in the Chilean NDC, and would love to just spend a few minutes thinking through what good integration of health in NDCs can look like, in case anyone is interested in taking up some of these advocacy efforts in their own country. So the vast majority of NDCs mention health, but the quality of this isn't always as strong as we would like it to be. So these are the issues that I just ran through on the previous slide. So we have health impacts are often mentioned, adaptation and mitigation in the healthcare sector, health co-benefits of climate action across other health determining sectors, and air pollution being another entry point. But now I'll run through what we see as the opportunities being to strengthen that. And I think I might actually have slightly messed up my slides, but let's see what comes next. Perfect. Yeah, so we want to move beyond health mentions to healthy climate action. And we want more than just lip service to health. It's really important to recognize the health links with climate change, but we need more than just words, we need action. So for an NDC to adequately protect health, for starters, it's got to be 1.5 aligned. We need actions both within the healthcare sector and across sectors in a way that maximizes health co-benefits. It's all very well specifying these actions, but unless there are budgets attached to them, whether those are estimated costs of what the intervention would cost, but ideally an allocation of budget to implement that action. Returns on investment calculations can also be really valuable for making the case as to why the action with health co-benefits is a wise one to prioritize. And then, of course, we need targets and monitoring, because actions, even if they're budgeted for, don't necessarily get implemented unless there is an accountability framework attached to them. And monitoring the health gains that we get from actions can be especially valuable for building public support for increasingly ambitious climate action. And of course, all of this is only achievable with improved multi-sectoral coordination. We know that we won't get health mentions in NDCs that are quality unless the health ministry and other health experts are involved. Next slide, please. So for the GCHA Healthy NDC scorecard, we've really looked at some of these issues of where health shows up and tried to map the different ways in which health shows up in NDCs. So to start with, we completed an analysis for, could I just ask if people aren't speaking, could they mute themselves? That would be really helpful. So we produced a few editions of the Healthy NDC scorecard, first of all in 2021 and then later in 2023. And then we did an analysis that was specifically focused on clean air, and that was published in 2023, and the links will be live when these slides are circulated by Milena after this call. And we wanted to do this to generate a degree of competition between countries to really show how health can be integrated into NDCs, because it's hard to follow, it's hard to increase the integration of health in NDCs without examples of how it's already being done. And we really wanted to showcase examples of good practice. Next slide, please. So here are just two examples of some of these different iterations of the scorecard that we produced. The first one is for Argentina, looking at health, and the second is for Albania, looking at clean air. And to unpack what we saw in Argentina's NDC, it actually includes health as one of 15 guiding principles that are intended to guide the design and implementation and monitoring of all national climate actions across adaptation and mitigation, which is really a helpful framing for thinking about how health should be embedded across NDCs. It's not just about one specific aspect of the NDC, it should run all the way through. According to the NDC, in terms of health sector action, impact scenarios have been assessed, and by 2030, policies, measures, and actions will have been implemented to provide a timely response to the new emerging epidemiological profiles of environmental and climatic changes, and also with attention to the operation of the healthcare sector. There's actions that are included on early warning systems. There's work being done on climate sensitive diseases. There's a dedicated health and climate action plan that's published in 2019 and referred to in the NDC. It also pays attention to the health of workers in just transitions, the health co-benefits of action relating to agriculture, to energy, to gender, to nature-based solutions, to transport, to water. So really, really comprehensive in many ways. But despite this, you can see from the scorecard that there's really limited attention to the economic and financial implications of all of this, and very limited attention to monitoring and implementation. So it really could have been strengthened. But even more importantly than this, we see all these great climate mentions, these great health mentions in Argentina's NDC, but its emissions reduction target is in line with 4 degrees Celsius. And we know that it's going to be really crucial to bring that much, much lower if it's going to adequately protect health, because we know that 4 degrees Celsius is not survivable. For Albania on clean air, some of the things that Albania does well is citing the impact of poor air quality on cardiovascular and respiratory conditions, especially in the capital city. The NDC refers to different health harming air pollutants, and it also mentions air quality monitoring. And the document, the NDC, also refers to the EU Green Deal for the Western Balkans, which includes actions around fighting air pollution, and there are specific measures for agriculture and waste sectors as well. And again, we're not seeing enough detail on economics and finance, and you can see the air pollution mortality displayed there on the Albania scorecard too. If we move to the next slide, you can just see a general mapping of NDCs around the world. This is from the 2021 analysis and how much they include health. And it's really striking to see how lower middle income countries, so in Latin America and the Caribbean, in sub-Saharan Africa, in Southeast Asia, really do a much better job of securing high scores on integration of health than we see in North America and in Europe, and in Australia notably as well. So we're really seeing leadership from low-income countries on the sorts of action that are needed, but of course this has now got to be funded. So there's a really strong role for high-income countries to play in delivering climate finance that is adequate to protect health. If what you've heard from Sandra, if we move to the next slide, inspires you to want to reach out and engage with your own government on the development of their next NDCs, the ones that are due to be submitted in February 2025. Some initial research that it might be useful to do is to look at where health is already included in your government's current NDC, and how this compares to other countries. And it might be useful to look at the scorecard for this. The links are on some of the previous slides. It'll be really valuable to speak with climate NGOs that are active in your country, and will often have strong roots to climate ministries that are the ones that are responsible for leading the development of the NDC. And it's also helpful to think about what your country's climate priorities are, or to find out about these. Again, talking to climate NGOs can be really useful here. But by understanding their overall climate priorities, you might get a better sense of where they might be sympathetic to including an increased focus on health. We found that when you're approaching governments, it's helpful to use the scorecard sometimes as a discussion starter, as a conversation opener. It's really, really helpful to ask your government what the timeline is for developing the country's NDC, because even though the deadline is February, often they will be submitted much later. You can inquire to the Health Ministry or the Climate Ministry about whether or not the Health Ministry is involved in the development of the NDC, and try and encourage those links to be made if it's appropriate to do so. And then also really helpful to know if there will be a formal consultation process with members of the public, and if not, are there other routes for influence, if not by a formal and public group. On the next slide, I've just listed a few resources that might be helpful for anyone that is hoping to engage with their governments, if governments ask for any of these resources to be shared, or you think it would be relevant based on the support that they need. Then there are some reviews by WHO in addition to the scorecards that I mentioned earlier. There's also some WHO guidance for including health in NDCs and also in long-term low-emission development strategies, which are essentially longer-term NDCs that run till 2050, mid-century. And there's also some guidance by Climate Action Network for this iteration of NDCs, including some on health in the annex of that document. There's a huge list of WHO tools here, specifically for adaptation interventions for health, but also lots on co-benefits for health and how to quantify those that result from climate action across sectors. And then there are some recordings from other webinars that will be live when the slides are sent around, one by UNDP and the NDC partnership, and one by WHO on NDCs and one on national adaptation plans. And I think, Milena, if we pause there again to see if people have questions, or I could cover South Africa now, whatever you think is best.
Thanks so much, Jess. Yes, any questions to Jess, to this presentation? Fiona, please go ahead.
There we go. Hi, thanks very much, Jess. That was really, really useful, particularly for an organization like us who are looking to kind of get involved in the NDC processes at national level. I know you said that it's kind of something that national governments can answer more so because not everyone submits at the same time. But is there like a set out kind of timeline for when NDCs are being developed? For context, we engage a lot with the voluntary national review process at national level. So we know that if we don't engage by a certain time, that the process has progressed too far. And I just wonder if there's any sort of guidelines on the NDC point of view as to if there is a stage where engaging is better done for maximum effect.
There is not a straightforward answer to that. I think different countries have different levels of capacity and invest time in developing their NDC in very different ways. So it might be a very short focus project, or it might extend for a year or more. So it really, wherever possible, is helpful to get that information from national governments. And just for anyone that didn't catch it at the start, NDCs are supposed to be submitted by February 2025. In reality, most of them will probably come through in Q2 or so of 2025, with a few more rushed before COP and a couple more after that. So I imagine that we'll see more timely submission this round of NDCs, the 2025 NDCs, than we did of the second iteration of NDCs, because they were due during COVID, which was really challenging in a lot of geographies, all geographies in fact. But yeah, wild variations on timeline and submission date, and I'm sorry for not having more precise information.
Thanks so much for the question, Fiona and Jess. There's another question from Lizzie in the chat. What areas of our NDCs should we concentrate on? Is this from Nigeria? Yeah.
I think to some extent this depends on where health has been included in the previous NDC and where the gaps are. And I think it also depends on the context of the specific country and where you're seeing the biggest health impacts or the biggest health opportunities of climate change and of climate action. So in global north, high emitting countries, it would be really valuable to focus much more heavily on mitigation actions than it would be in the global south, because the contribution to emissions is so much lower. So looking at the health opportunities of cleaner air and healthier diets and physical inactivity for mitigation in the energy, food and agriculture and transport sector. Whereas in global south countries, where the priority in so many settings is much more adaptation focused, then looking at how to build resilience in the health sector and the agriculture sector and water and sanitation are just some that spring to mind. That's a very broad answer to your question, Lizzie, but I hope it's some small use.
Thanks so much, Lizzie, and please feel free to check the NDC scorecard, and there you will find a detailed answer on what is already being included in the Nigerian NDC. Hopefully this will help. Any other questions? If not, I think we are just on time to continue with the experience from South Africa. Maybe this will give further clues.
So this is some work that GCHA was able to do with partners that we have in South Africa, and also AMREF, that works more broadly across sub-Saharan Africa, as well as with the University of Wisconsin. So the context here was that there was a public consultation for the development of South Africa's second NDC. That consultation was hosted by the South African Department of Environmental Affairs, and it was online email submission in format. And the University of Wisconsin had already done some work on the US NDC and really highlighting the opportunities for health co-benefit actions and doing some political mapping about what might be possible in that context. So we built on this in collaboration with South African and Sub-Saharan African partners to put together a response to the text of the draft South African NDC, and we suggested ways that health could be more deeply embedded based on what we could already see in the draft, and also provided a cover letter with some arguments and scientific rationale for why it would be valuable to more deeply integrate health. And what was interesting for us is that when we scored the final NDC according to the NDC scorecard methodology compared to the draft NDC, there were actually 5 additional points that were scored for inclusion of health. And we suspect that the main health actors that would have submitted to that consultation were the ones that were involved in the submission, which hopefully is an example of advocacy being effective, at least in one context. So really happy to answer any other questions on that too.
Does anyone have any question? Is there a special program in?
I shared in the chat about, whether or not there is a special program in Algeria. And unfortunately, I'm not aware of one off the top of my head, but really happy to check with Milena and I's colleague that leads networks and engagement to see if she knows of any partners that are active in Nigeria that we could link you to. I'll put my email in the chat in case it's helpful for follow-up.
Thanks so much. Any other questions? Maybe, if not questions, maybe you could share with us if you've had any experience in reaching out to the Ministry of Health or to the Ministry of the Environment with regard to the update of the NDC. Any lessons learned would be helpful for everyone. Yeah, Lizzie?
Thank you very much. Sorry, I'm not showing my picture because I'm not properly dressed. Now, in our own country, I'm a Nigerian. NDCs comes from agriculture, health, and other departments, environment. And that was why I was asking, which areas are relevant that we can capture? For agriculture, we work on it and we contribute to the national integration when we meet to discuss it. But as a health and nutrition expert too, I was trying to ask if we should expand and also work in the area of collection of nutrition contribution and health to the data for NDCs. So I want an elaborate explanation of how we can expand our costs and what else we can do apart from what we are doing at the moment. Thank you.
Thanks, Lizzie. And I think when it comes to agriculture, I think so often the focus on agriculture can be around making sure that there is sufficient food for profit and export and not necessarily a focus on nutrition. I can't comment on whether or not that's the case for Nigeria, but I think making sure that the framing is around whether or not people have access to diets that are adequately nutritious, but also affordable, because we know that as food supply becomes restricted in some settings due to climate change, that can drive prices up and mean that fresh produce is completely unaffordable for many populations, and that they are driven to and I don't know if this is true for Nigeria, but they're driven to consume more processed or imported foods that might be available more cheaply than fresh produce in some cases. So I think they are the things that it would be useful to think about when advising for increased focus on health in agriculture plans and NDCs. But I'd also suggest looking at resources by the Food and Agriculture Organization. They do a lot of work around climate resilient food systems and seeing what links might exist with health and nutrition there.
Thank you very much. I appreciate.
Thank you so much. Are there any experiences someone has to share with us to learn from your engagement with the NDCs? Well, hopefully this session will help everyone that is obviously interested in engaging to take some steps, and we'd love to hear from you later. If there are no other questions, we'll just close here, and thank you so much for joining us. Please stay tuned as we are scheduling the next session of the Global Engagement in Climate and Change and course. It is going to focus on the impacts of fossil fuels on human health and is planned to happen in the second half of October. There is other programming apart from the pilot course, so stay tuned about this as well. And thank you so much to our interpreter, Andrea. And have a good rest of your days or evenings.